Well, good evening, everyone, and welcome to tonight's online community forum. I'm Pam Duncan. I am the President and CEO of the Metropolitan Development Council. I'm so glad to continue to say that we partner with the Tacoma Urban League, and my cohort, Senator-elect Twina Nobles, is here along with Amanda Westbrook for the series of conversations. Twina.
Well, thank you, Pam. Tonight's conversation, and I can't believe I'm saying this, is the 27th series of discussion where we are diving into the different ways that COVID-19 is impacting Tacoma and Pierce County. Tonight, we will focus on the latest surge in new COVID-19 cases in Pierce County and across Washington State. And we'll talk about what lies ahead and the steps that you can take to keep yourself, your family, and your community safe as we enter the winter months. Our guests tonight are Dr. David Hirschberg from the RAIN Incubator and Pierce County Council member Marty Campbell.
We will continue to be here for the community throughout the COVID-19 crisis with new conversations with a purpose every Monday evening at 5 p.m. The most important message throughout these series of conversations is that there is hope for our community. Our focus is to create space in each meeting to talk about resources and things that we all can be doing to help get us through this pandemic. Ms. Amanda.
Thank you, Pam, and thank you, Senator-elect Nobles, and welcome to our guests, and thank you, Rob Huff, for your continued expertise. We'd like to take a moment to acknowledge that this meeting is being conducted on the indigenous lands of the Puyallup people. We gratefully acknowledge that we rest on the traditional lands of the Puyallup people, where they make their home and speak the Lushootseed language. Throughout today's conversation, you can submit your questions to be addressed by our speakers using the Q&A answer function in Zoom. We cannot promise that we will have time to consider every question, but we will make our best effort to get through this in our allotted time. So, good evening, and to get started, I want to check in with each of you, including Pam and Tawana and Rob this time, to simply see how are you holding up today? And I'm going to let you jump in as the Spirit directs you.
Well, I'll jump in. I'll get it started because dead air is not good. And as a politician, we are quick to fill dead air. How am I doing? Today's okay. It's getting dark earlier as I look out my window to my left, and that's beginning to, I sometimes get affected by that seasonal depression. Then you overlay COVID, then you overlay the restrictions from the governor, and then you overlay budget problems. I mean, there's so much stress that no one dominates it all, and so it just kind of deal with it in a block. And I think, like most, I'm taking it one day at a time. Feels like a year at a time, but one day at a time, and just try to get through and spread some positivity around. So happy to be part of this group of lots of happy, smiling people.
Thank you, Councilmember Campbell.
I am feeling pretty good. Last week we had our annual Empowerment Awards for Tacoma Urban League, which is a fundraiser. Thank you. Thank you all for joining and participating. You can still watch it live on YouTube. Just search Tacoma Urban League Empowerment Awards. But there was just such a powerful message, and I really appreciated an opportunity. I know many of us are doing our end of the year galas, but I just think they're so important to continue to be in community, even though we are virtual and apart. I think it's important to pause and celebrate the good work that has happened. We have experienced a lot of loss. This newest lockdown is going to impact, many of our community members, our businesses. It's going to impact employment and our mental health. So I think it is important to, search for the silver lining and to thank folks who are helping us to get through this pandemic. So I feel very grateful for community, grateful for leadership, especially at this time, effective leadership. And I'm excited to be here with all of you.
Thank you, Senator-elect Knowles.
Well, I'll weigh in a little bit. I am very anxious. I've actually been waiting for this really the state to kind of get out there with some kind of messaging as I watch the cases go up, and so in a way I'm a little bit relieved. Of course, still worried about all the economic impact and whether knowing even that this lockdown is enough at this point. So definitely very concerned, anxious, knowing kind of what we probably are going to go through in the next couple months. At the same time, I'm as a scientist and researcher, I'm very optimistic. There is some good news coming. We're going to have to be resilient, and I know we can be, and this community has really faced a lot of hardship. And so I do think there's some very positive news coming, especially with COVID-19. But it's, I don't mind the dark. I love the rain. I love this part of the season. I just miss not being able to socialize and go out and interact with people.
Thank you, Dr. Hirschberg.
I would echo part of Dr. Hirschberg's comment, the part about missing socializing, not the part about not minding the dark, because it's tough on me. It's always, this is a tough time of the year for me. I will say, I am not surprised about the space that we are in. We had talked about this over the summer and kind of expected it. So doesn't catch me off guard, doesn't surprise me. I am very concerned, and I'm glad that we have this venue so that we can talk about it and how we can do everything within our power to, again, lower the bell curve and shorten it so that people are not being impacted. We can get in front of that.
Thank you, Pam.
And I'll close out. I will also reflect the fact that I'm missing the social interactions with people. I have a running group that has not been able to meet since March, and so that's been difficult. But
Tacoma runners.
Yeah, Tacoma runners. But when we are ready, I am looking forward to being able to do that again. And that's one of those pieces of hope that I look toward, is the opportunity to have those kinds of fun with a group of people whenever it is safe again. So.
Yep.
Thank you, all of you, for your check-in. So to everyone who is listening tonight, I want to share that our conversation is likely to cover a lot of ground. From the rough COVID news, as we all are aware of right now, to the optimism of what could be coming in the new year, with things like vaccines that show a lot of promise. So tonight is not just going to be a gloom and doom story. So let's open with something that's on our minds right now. How are all of you dealing with the frustrating news that the numbers of COVID cases, as we know, are at record levels? And also, how are you dealing with the fatigue from this whole situation right now? And I want to encourage our audience to go ahead and also answer that question in the Q&A.
It has been especially hard just dealing with the pandemic. It definitely has been an exhausting experience, just with the ups and downs and highs and lows, and we're making progress and now we're moving back. And I think where I am right now is just my heart breaks for folks who just can't sustain this. I had someone message me and say, no, my child just went back to school, but it sounds like K-12 and higher ed may be exempt from some of the requirements because they've already put a lot of protocol in place. So they may not have to make as many changes, but we'll see. I know I've spoke to a couple of folks already who have been notified that their employment has changed, or they've lost their employment. And simply there will be businesses who will not be able to survive this next shutdown. I mean, they got through the first one, we're able to secure some funding, but this will hurt some of our businesses that we won't see again. And there is no way to feel good about that. I want folks to, stay responsible, wear their masks, take this seriously. I think we just have to work harder and work together to try to lower our cases. I'm excited that there, is a lot of positive news about a vaccine and effective vaccines. But I just think there is something that we can do here on the ground in our community by staying home and staying out of large group settings and just being more careful and caring about those around us. But I knew, as I started to hear more people that were in my circle say that someone they knew or someone, their roommate or their colleague had caught COVID, it started to become closer to home. Now, people I know have caught COVID. Thankfully, I have, maintained my own, social distance and worn my mask and tried to be as responsible as possible. But I knew it was serious the more people who were closer to me that had been exposed to or knew someone who caught COVID. Because months ago, it was like, do you know anyone? Do you know anyone? And a lot of us hadn't. So it is serious now, but, there is just something we can do. And I hope that folks will, participate in doing that, wearing their mask, washing their hands, and, staying home and in their, intimate family circle as much as possible.
I'd like to come in behind Senator-elect and say, she said the operative word is serious, that we really have to take this serious, and that for so long, so many people really did not take it serious. They said, oh, it's just a cold, or it's just like the flu. And because as a country, we did not take it seriously, we're seeing, in part, that's to contribute to the rise. But we really must take this seriously, because we can't have our hospitals be operating beyond capacity, and then that person who one of us knows and loves, or maybe even God forbid is us, we're the ones who can't get the help that we need. So that's just the main thing that I want to say. And of course, I will defer to Dr. Hirschberg about other ways that we operate in the space we're in now.
Well, I'm going to jump in. I don't have much to add. I mean, to hear, leaders in the community like Tawana and yourself, Pam, really, and really speaking out, and Marty also just being able to kind of voice these things. These are the things that were so alarming to me in the beginning, when there was just a lack of people standing up and saying, we have to really take care of ourselves. We have to flatten this curve. And I think this was a forum that very early on said those things. And we have to keep saying them. And you can see, again, how other countries are handling this. Even in our area, we're doing a little better than other parts of the country that really weren't taking steps to really protect the people, our first responders, our people at risk. And so I think, I think that is really, we have to keep doing this. We have to double our efforts. We have to really, the fact that you're balancing something like education for our children and taking those risks, which is a good thing because that's really balanced, to making sure people have access to mental health and really, or people who are at risk even in their own home, looking out for them while still minimizing a bunch of the unnecessary social functions, like giant weddings, monster gatherings, parties that are, they're just not appropriate now and put people at unnecessary risk. I think there is a balance. There is a way we're going to find this. I wish our initial starting numbers were lower because I think we would have a lot more freedom when you talk to people in other areas of the world that have done the work and really minimize things. They are working. Their kids are going to schools, and they are responsibly interacting and socially, and they're not. They're still, they're minimize the risks. So, yeah.
I'll join in on my frustration. In my circle of friends, there's a lot that are taking this very seriously. They're masking up. They're limiting their trips outside their home, wearing a mask when they do. But the frustrating part for me is just those who've just utterly refused, who've seen this as a political issue and not a medical issue, who want to debate the science. And the fact that we're debating whether or not it's real rather than what is the best approach to dealing with it has been a massive distraction locally and nationally, hurting us much more on a national level. My heart hurt. I'm originally from Nebraska, and every other day I'm calling my parents like, what do you mean you're out getting ice cream? Go home, stay home. But the message that they're hearing where they live is it's a hoax, and now they're number 5 in the nation in cases per population. Right now, the county they live in is one of the highest risk counties in the nation because, and it just scares me to a core, and there's nothing I can do from here. And I know here locally, when this first started up, I've run resolutions at the Pierce County Council after the health department did a resolution suggesting that everyone should wear a mask back in, this was April or May. I brought the same resolution to Pierce County Council. Let's do a resolution that just recommends everyone wear a mask. It failed 4-3 on party lines. And then I called over to the executive's office. Will you please issue it? Nope. And even this last weekend, when he put out a statement that was very supportive of Inslee's position of going into, going back a few steps in the phase and shutting down some businesses, he says Inslee's doing the right thing. He still would not put in there, we recommend you wear a mask, because I don't want to speak for them why they're not doing that, but it's frustrating because if we would see that strong leadership on both sides of the aisle saying this is really not an if this is real, but how we approach it, and a mask is acceptable. I saw something on Facebook today about a mask burning party that someone plans to have. And it's just like, I try to empathize. I try to put myself in someone else's shoes, and I can't get there on this. And that's frustrating because it's like, what can I say or show you just to believe this is real, and then start making some choices from there. Instead, you want to do nothing, create a larger manifestation across our community, and then blame those who are stepping up and taking action that is more firm than they would have to take if everyone just was sensible in the way they do it. So that's a lot of frustration. The good news, I think the doctor touched on it, our numbers, and we're actually in a really good bubble here in Washington. At one point we were number 1 in the nation because we were ground zero. Where it started. We had more cases per person than anyone. We're now 45th, 46th, depending where you're looking. So that tells you how much of the stuff we've done right. And every other state hasn't looked at us and said, gee, what's Washington doing? Because they keep falling down that scale and we keep flying up it. And so when people are like really critical of the response, I'm like, yeah, but compare it across the nation, we're doing really good. And we're still struggling and seeing hundreds of cases a day here in Pierce County. If this is what good looks like, what's it like in some other places?
Thank you, Council Member. And this next question may bleed into the question I just asked, but over the weekend, as we know, the governor imposed new restrictions on restaurants, bars, gyms, and other businesses to try to slow the spread of the virus. So question for both of you, Councilmember Campbell and Dr. Hirschberger, and Pam and Senator-elect Nobles, please join in if you'd like to. Are these kinds of regulations going to be enough to make a dent in how the virus is spreading right now?
I'll pick back up on that. Yes, and I think the governor was definitely kind of forced into making this decision based upon how the numbers were going. I remember seeing lots of Facebook chatter right after the election. It's just going to go away. Everything will be dropped and we'll be back to normal. And it's how this makes a dent is, one, it actually reduces those places where people are bumping into each other and transmitting it. And it also has just put awareness back in the forefront. Remember back in March when it was, here's the songs you sing while you wash your hands. Here's, we were all talking about it, then we stopped talking about it. And this puts it right back up front as to how quickly things can backslide and how it's going to impact your friends and neighbors who own businesses, how it impacts that. And so I think the dent comes, one portion is the actual action of not creating these bumping spaces, and the other is moving awareness front and center, because I think we've all gotten out of our car without the mask and we get up to the door and we're like, oh, got to go back. It begins to fade that top of mind. And this is a harsh lesson to keep it front of mind, but hopefully it helps drive the numbers down quickly and we can resume for many of these people.
I totally agree with that. I mean, my biggest, the point that was made was the idea that science and even public health is politicized. I think those communities that have figured out a way to not politicize this, where you really look at this as a centrist issue, meaning that the virus really doesn't care. You look at places like Australia, which has 0 cases right now and is doing a very good job. That there's definitely extreme views on politics, and there's the right wing and left wing, but they've really come together on this issue. And I think this is really what we have to do. I mean, nobody who's really looking at this wants to shut down an economy. I just can't imagine. That is. It doesn't have to be both, either or. It's really safety and people being at work and having jobs and going to school and being educated. And what person would not want those things? So these are, we have to get these kinds of things out of politics. We mentioned that this area is kind of in a bubble. We are starting from a very high level, but it's definitely that's higher in other parts of the country. But it's still, ultimately, you really want good leadership in areas, in regions, across the country, working together and, really minimizing the number of cases that are going to move towards our hospitals here in the coming weeks.
So as a follow-up to that, Dr. Hirschberg, does it feel like that the fatigue is perhaps an American symptom?
I think people are tired all over the world. I just think, there's people been working very hard. And I just talked to some of my Korean researchers that are, they have outbreaks all the time. My daughter lives in Berlin, and she teaches, and she teaches 0 to 2-year-olds in a school there. And they're constantly having outbreaks. And I think people are tired everywhere. And I completely understand that. It's just it's just something, you have to be gritty and you really have to have resilience to get through this. We will get through this. But, the most we can do if we're vigilant all the time, we are going, even today with this things as bad as this here, we are going to minimize sickness, death, suffering if we really take precautions and really look at this as something we're doing to protect others, it's not a matter of rights. It's the right to everybody to be healthy and be at work in a safe place and be able to continue their lives.
Thank you for that. Pam, what would
So
you
I have a Yeah, I just found that very fascinating when Dr. Hirschberg mentioned that there aren't any cases in Australia. I mean, that's very fascinating. To what would you attribute that? Because it's not as though people aren't or weren't going back and forth.
Yeah, there are outbreaks there, but they're very quickly traced and settled down. So it has been a number of days with zero, but they have very, very low cases. Also, New Zealand is some case. Now, people will argue it's an island, but it's more than that. It really is actively, once you get to a point where the cases are minimized, it's an active work every day to minimize it, contact trace. But of course, the cases were low to start with, and they actively spent a lot of resources on keeping those cases low.
Thank you.
Councilmember Campbell, would you share with our audience how your position on the council is connected to the Tacoma Pierce County Health Department? So I can then ask you the next question.
And I've, of course, borrowed my background. I'll do it so you can see it. That's from the health department and what that they're running. And so the Tacoma Pierce County Council provides a significant portion of funding for the health department. It's created with interlocal with the city of Tacoma, and we both provide funding. And then so there's 3 council members from the Pierce County and the executive, and the 2 council members from the city of Tacoma that serve on that, and they make up the board of directors. And so they then help guide Pierce County Health. Tacoma City Council member Catherine Ushka is currently the chair of the Board of Health and has been doing a great job this year. I myself am an alternate to that board, so I get a lot of the information, but don't have to attend every meeting. But so I get a lot of what they're working on over there.
Excellent. Thank you for that. So based upon your connection, how is the Pierce County Health Department holding up right now? And then as a follow-up, do you have a sense of how the community you represent is doing?
Oh, those poor souls over there. They're actually holding up great. But man, when we think about people who just beginning February were stepping up to long days, and it's been just this unending, just after another. They're doing a great job, and they deserve, the highest accolades that we as a community give, because there was a time when public health was really front and center across this nation. And it has been from time to time when we faced a variety of diseases, but things as simple as waste treatment, all these things that used to be major public health, and they've gotten so good at their job, be it restaurants or whatever, that they've kind of faded in the background, and people have forgotten about how much our daily lives are impacted by public health. And so it's good to see it back. Well, it's not good to see it back front and center, but hopefully they're getting the recognition they deserve. We have some amazing people over there. And I think it's one of the reasons why, even as a county, we're outperforming a lot of other counties in the key metrics. And I think a lot goes to that. How's it impacting my district? My district, 5th district of Pierce County, east and south end of Tacoma, Midland, Parkland, Spanaway, Summit, Waller. We're hit hard. And it's an area of high poverty. It's an area of high social determinants of health, where we have some of the worst outcomes, and we have for years. And you throw a pandemic on it, that doesn't help your outcomes. all the things that were stressors before, unemployment, access to healthcare, access, just the impacts of poverty, all those become magnified in a pandemic. And so you've got a community that when we see unemployment, we know it's hitting Pierce County harder than most counties, and we know that it's hitting East Tacoma more than most of the rest of Pierce County. And so it's been hard. We've worked really hard, myself and others, to be advocates for including equity in all of our responses, to use some of the maps that the health department puts forward that show health inequities, and use those as the examples of why we need to start in communities of color, and make sure that that's where we're putting that forth, because we know that when we help those with the most barriers and challenges achieve, that it helps everyone. Because if you make it easy for someone in East Tacoma who's facing a rent challenge, who speaks English as a second language, you find a way to navigate them. Someone who's just who normally has a good job and is just found themselves needing to reach out has a lot easier pathway. So it's not going to say it's been easy. It's been hard. It's been hard on a lot of my friends who own small businesses, but we're really trying.
Thank you for that, Councilmember Campbell. Dr. Hirschberg, it has been a while since we last did Straight Talk. Can you tell us what kind of work you and the people at RAIN Incubator have been working on in the last few months?
Yes, it's been a long, we've worked some long hours. So one of the thing I'm probably most proud of right now is that we've trained about 20, I have full-time and also volunteers here that are to really do a lot of build these tests that we've been putting together. So for the community, we've developed a molecular test, which is the RT-PCR, the reverse transcriptase PCR, in-house. And we also put together an ELISA test, an enzyme-linked immunosorbent assay that tests for the antibodies. So these two tests, one test for the virus, one test for antibody circulation, we put in place very early. And we've been doing, with the molecular test, we started doing sewage testing in Tacoma. We began testing in late March, early April. And we've continued to do that, not only for Tacoma, with a lot of sites here in the central plants, but also Pierce County and many of the smaller sewage waste treatment areas like Gig Harbor, Ording, Sumner, and then even some outside the area as far away as Alaska and Arkansas we've worked with. And in addition to continuing to do these functions, we've actually now started working with Tacoma, Pierce County Public Health to really work with the epidemiologists there to feed our data into all the data they're collecting, and really look at locations and try to see if we can map sewage testing. This is the early warning, what we're calling it, because the virus we know is present in feces, and so you can measure it without really one or two tests. You can really cover huge amounts of area, and so we've been doing that. We've also been testing. I have a protocol in place, and by the way, I'm looking for volunteers, but we do go out and test some of the schools. These are de-identified samples, and we under this protocol, we've been doing skilled nursing facilities, schools, individuals, to really collect data on the how prevalent the virus is in the community. And this testing has given us information. Because of this testing, we've actually been able to attract many companies to Pierce County. And so now we're working with companies that either want their tests validated against ours because we have all these controls, or they're interested in maybe even working with us to validate a lot of their technologies. And so that's been really good. It's given the students here access to these big companies, but it also guarantees us reagents in the case, if we have another big surge, we've kind of mapped out a whole alternative, I guess, approach to doing these tests that doesn't take away from the work that the hospitals are doing. And in addition to that, we've attracted a number of places that would want to set up long-term CLIA labs here, not just the mobile labs that we're getting, but labs that will stay here and create jobs in our community after COVID leaves this area. So access to newer testing facilities, and then also training our people, our local people through that, and then hopefully even attracting some manufacturing. So those are all the things that RAIN's been kind of doing, and again, in partnership with a lot of the people in our community.
Dr. Hirschberg, have you slept since we last saw you?
I don't sleep very much. Pam knows that. I text her. We've texted back and forth in the middle of the night. So this weekend actually was 18-hour days here, making sure some of our buffers were working correctly, and that they're as good as what you can get commercially, so that when we can't get them commercially, we know we'll be able to provide them.
My goodness. So what plans do you, Marty Campbell, and of course Pam Duncan and Dr. Hirschberg have for the upcoming holidays, and have you canceled those plans with family and friends? And I see you shaking your head there, Pamela Duncan.
I actually just had to send a message to my cousin who's from California and is up here visiting his partner, and he had reached out. He said, "Hey cousin, I know you love to bake pies, and I want to come over so you can show me how to bake some pies, and I'll buy everything." And I just had to text him and say, "You know what, we can't do that, because this is what the governor says, and you are not a member of my household." So that's even pre-Thanksgiving or any other holiday, but I'm serious about that. I think it's very critical, especially with this being a season where we're having an intersection of COVID and the flu. I just want all of those things to stay far away from my home.
I hear you. Councilmember Campbell, what about you?
I'm going to show members of my family that I love them by not seeing them, by not spending time with them. I'll call them, Zoom with them, FaceTime with them, however I may, but definitely celebrating by not spending time with family so that I can spend time with them into the future.
Yep.
Mm-hmm.
I've canceled my Thanksgiving plans. I have a daughter that's down in Eugene who's in the senior in school, and I'm fortunate that I can test people here, and so I can quarantine them, but no large Thanksgiving. My parents are down in Morro Bay. My dad just turned 95, and I missed his birthday. And we're going to do it by Zoom. And I think, we were able to kind of squeak by earlier in the year by doing a couple gatherings, right? And nothing happened. But I just want to, I want people to understand that what dictates the spread is really that background virus in the community. And when it's 4 or 5%, you can get together, you can do a few gatherings, you can meet in a pub that's only 25% or be outside. But when it's higher, if it goes higher, where it's 15, 20%, in Anchorage today, it's about 20% of the tests are positive. It is unforgiving, and the consequences of 2 or 3 people being infected at a gathering rather than 1 or 2, the spread is much more dangerous. And so, I'm just not going to risk it, and I hope we can communicate to everybody that nobody is nobody's going to get a pass on this. It's the risk is very high for everybody if you bring a lot of people together.
Thank you for that. Rob, I'm going to call you out on this because you have a new family. You are just recently married, and I know when I was recently married, my first year, I had all of my in-laws over. I had everybody over. And so tell me, what is the holidays going to look like for you and your new bride?
So really, it is going to be sitting at home. We'll still, make a meal and make the most of it. We actually have an exchange student from Munich living with us right now, who's having a very odd experience of America, doing school from home. But so she'll be joining us, but it'll be just the household. So just my wife, stepdaughter, and our exchange student and I, enjoying our own company. And we would have loved to get together with more folks, but like Dr. Hirschberg has said, it really isn't safe.
Absolutely.
I mean, you can do a nice walk at Point Defiance or down on the beach at low tide, and you can meet people and stay, a couple meters apart. And there are alternatives. You can go for hikes, arrive in separate cars. So there are a number of ways we can figure out how to do it. You can probably get together outside on your deck and just bundle up and stay a little bit apart. And so there are ways we're going to figure out how to do this, but it's, the safety has to be, the main thing we're talking about.
Dr. Hirschberg, you just gave us some good news and a wonderful way to think about seeing that family if we need to. Today we heard news about a second vaccine that shows a lot of promise in early testing results. What can you say about that from your knowledge of vaccines?
I'm very excited about it. So I think both vaccines, both companies that have now shown safety information and protected and antibody information, it's very promising. This class of vaccine is an RNA vaccine, and so it's this basically you're injecting RNA and programming the cell to make proteins that are going to then generate antibodies. So instead of essentially having a factory make the vaccine like we do with our flu vaccines and everything, we're actually injecting people and then they make the vaccine. And this type of vaccine has been promising for years. It probably took something like a pandemic to really roll it out and start the testing. What's exciting is it's going to be able to be scaled up into really, hundreds of millions of doses to billions of doses within timeframes of months. And so for the, long term, that is very promising. And this is only two vaccines. There, two different vaccines. There's a number of vaccines that many companies are working on now, and this is extremely exciting and very promising.
Dr. Hirschberg, I want to follow up to that because it occurred to me as we look at vaccines that work, help our bodies fight that naturally. A point of conjecture, what happens when that kind of vaccine is put into a body that has a compromised immune system?
Well, so, there is going to be these safety safety studies have been done. People who have compromised immune systems don't make very good protection, but it doesn't mean that the vaccine is unsafe to those people. They're just not protected. You've heard of the concept of herd immunity. This is, even if you're vaccinated and you make a very good response, if you walk into a room of unvaccinated people, you can still be overwhelmed if titers are high enough. So it's going to be very important that people get vaccinated and we build up that immunity over time. And so, and that protects, in all the other vaccines we have a lot of people who are immunocompromised. They're protected because the chance of them coming in contact with an infected person is very low because the rest of us are vaccinated. So we carry those people.
Good to know that. So what do you think is a realistic timeline for when the arrival of new vaccines will make a significant impact in terms of how we live our lives here in Pierce County and in Washington?
Well, I hope I'm wrong, but I would guess that by next summer, the vaccine will be at high enough numbers in people with countries with the resources we have, such as the United States, to really make a difference. But the idea of this coming before next summer is pretty unrealistic, except for people who are exceptionally high risk and who are going to be given this vaccine first. And that's why it's so important for us to really continue this, flattening the curve, doing everything we can to keep those at risk safe, and really doing everything we can to minimize the spread. We will get through this, but those vaccines will not generally be available until next summer, and will not start making a huge difference until going into the next flu season and the next, unfortunately, COVID season.
Thank you for that. Pam, what would you like to add?
Well, actually, a question. I took note when Dr. Hirschberg mentioned about countries like ours that have resources for the vaccine. I'm curious, just out of plain curiosity, what does the data tell us about the occurrence of COVID in Africa? Are there places where it is just fairly non-existent, or is it the opposite?
Well, so actually Africa is, I would say, as a continent, is doing very well compared to some of our, they're more, what we consider more sophisticated with more resources and everything, neighbors. One of this is because, the main way we can prevent the spread of this is very, very basic. And, it's really respect for other people, social distancing, wearing a mask. And so there are ways you can isolate yourself and minimize the spread of disease. And I think Africa, there are certain countries that have just done a stupendous job with this, and in Africa. And I think that part of that is the tropical health training there, and really they have. This is just another disease that really they are combating, and with minimal resources. And so I think that there's been in the DRC and places like this that have just gone through Ebola, there is already a culture of understanding how to minimize the spread of disease, and these are basic techniques that frankly we've kind of forgotten.
Great question, Pam. Thank you for that. This next question is for both Councilmember Campbell and Dr. Hirschberg, and we'll start with you first, Councilmember Campbell. We have a new national administration and a COVID task force. Hallelujah! I was going to put that in there since I'm an individual consultant and it doesn't reflect anybody on here. That's my caveat. That's being created by the incoming Biden administration. What do both of you think of that development, and what could it mean here in Washington with the change in leadership in Washington, D.C.?
I'm excited and encouraged by it that President-elect Biden is putting together this task force. I hope that it's allowed to connect before January, that they're able to, that they're not, that there's not a wall put in place, that really we start finding, at least on COVID, start working together now, take that leadership. I think that bodes very well for our state, in that, we've shown the leadership. We've moved the numbers down or held the numbers lower better than most states. So I think that we are a model that other states can look to, and hopefully the task force will look to. And being in that forefront gives us the opportunity to be leadership in rolling out recommendations from the task force. But I'm excited to see it coming forward and hope that it gets here sooner than later.
Yep.
Hear, hear.
I am very excited about the task force. Again, depoliticizing, this is really the first step. Anybody who's embracing evidence-based approaches and science-based approaches, I commend. I actually know 2 or 3 members of the task force. I think this is, and really, I just want to say that, many of the people I know who have been activated are government employees that have been spending 30, 40 years in infectious medicine, infectious disease research, and treating infectious diseases in medicine. And they're not, many of them are very conservative. They are Republicans. They are, it's not a political thing. They are really dedicated to this work, and it's just never been part of an ideology. It's really about evidence-based and science-based approaches. And so I highly commend this. I think these kind of approaches really to really show what practices are making a difference really are something that is long overdue. And I want to just comment that, when we think of the United States right now not being leaders, our practices, the work that we've done on pandemic response has really been adopted all over the world. Many of the people on Biden's task force have spent their careers developing vaccines and really working with people all over the world, training them. And this hasn't stopped through all these months. It's just really a failure of our leaders to not acknowledge that training and implement it. Other people in other parts of the world, whether they were right wing or left wing, adopted those teachings and that training, and that has made a huge difference in human life and suffering.
Thank you for that. Councilmember Campbell, you spoke about your district and some of the barriers and how difficult this has been. And so I want to ask the question, what do you see are the biggest ways that Pierce County can continue to help people who are struggling with the personal impacts of COVID-19? And Straight Talk has covered those personal impacts, from dollars to donuts. We've talked about them. So how can we help those people who are still struggling with those impacts of COVID-19 throughout the end of 2020 and also into the new year? And, I'm talking everything from food is free tables to unemployment to housing to the eviction moratorium that's going to, expire on December 31st. That's a lot to put on you, but I know you've been thinking about this, so I'm going to let you answer the question.
Well, thank you. And that's a great question. That's frankly on the minds of so many. First of all, I'm going to step back and say this, that the best way that we can get ourselves back is actually the U.S. Senate needs to step up and take the bills that they have laying on the table and get them passed by the end of the year. That is hands down the fastest way to get the need we need across a broad spectrum. Here at Pierce County, if you remember back to the CARES Act, which passed real quickly when this was still seen as a bipartisan approach, Pierce County was fortunate enough to receive $168 million in CARES Act funding to be distributed. We split that up among 4 main categories: public health receiving the bulk of it, community response and resilience, economic stabilization, recovery, and essential government, making sure that government still functions. Public health, a lot of that's gone to contact tracing and really shoring up our health department. So where we look at how can we help people, that really comes down to the community response and resilience and the economic stabilization and recovery program, both keeping people housed and keeping them at work as best as we can. And Pierce County, and why this is important, that we've been great, I think, about getting it out to a broad spectrum. There's counties in Idaho that received similar funding proportionately, and they invested it all into a big business, and now they're getting hit with COVID and they're having to send patients to Washington to be in the hospitals because they didn't invest in public health. And so we've, again, the bulk of our money has gone into public health. When we look at the community or the economic stabilization recovery programs, that's been workforce training, that's been helping small businesses, that's been paying rent for small businesses, youth and young adult jobs programs, support for technical colleges, and just straight up, business relief, because we want to keep people in business. And as a matter of fact, tomorrow there will be a bill that I'll be bringing forward that will to small storefront retailers who suddenly are hit hard here. This should be their big month, and things are going to be tough for them. Contact Pierce County. The proposal will be, and we'll adopt it tomorrow, hopefully, $10,000 just to help them pay their employees, have the inventory they need, you keep the lights on, whatever it takes to get them through. Because I don't want to come through this and have our commercial districts, have every other storefront vacant. We need to do that so we have something to return to when we come out of our home. The most important, though, has really been the community response and resilience. And this is where we started off. I mean, it was first week I called over to EFN and said, what do you need? And before we even had CARES Act funding out of the general fund, we were getting them at that time $250,000. Wow, we're going to give them a lot. This is what they need. Turns out we've repeated that every month, and have another bill coming up tomorrow to give to supply up to $100,000 to pretty much every food bank in the county just for capital expenses, so that they can then continue to move the food out as they need. Community response resilience, emergency homeless sheltering, rental assistance, maintain homeless supports and shelter capacity, veterans emergency, foreclosure prevention, counseling and mortgage assistance, senior center support, behavioral health response, $1.5 million there. Child care support. This is important. We've got to be able to help with the child care, particularly those essential workers who are having to be out there, or even people who's just need to be able to have their kids cared for. More support for affordable housing, domestic violence support, access and capacity. At first, we saw a downturn in domestic violence simply because people were in their homes and they were kind of in this together. And now they've been together for too long, and the numbers are sadly coming back up, as we knew that they would. And I just heard a report from our prosecutor this morning. We have an almost 100% increase in this county in domestic violence homicides. So we're not just talking domestic violence; we're talking serious violent. The numbers are down, but the ones that are coming in are more violent, and we need to make sure that we are getting money into that to support that. Other and what I'm looking through is what we've funded here in the past: special needs transportation services for seniors, adaptive recreation to expand parks and to adapt our parks so that, as the doctor said earlier, there's ways to meet in our parks, but our parks have to be set up for that too, and so what can we do in our parks to be able to be that? Whole child summer camp was something. We did a first responders childcare camp. This goes on and on and on. And it's, we look at it and we say, oh, we need mortgage assistance in this. And what we really need are 1,000 little things all doing their things right. And when you look at the complexity of government, you've got farmers markets or childcare or just so much different. Every sector's been hit by this. And so how do you stand up and support every sector? We're doing the best we can with our $168 million. I'll put what we've done here in Pierce County. I'd love to compare it against what a lot of others have done, because I think we've really hit it out of the park. I know myself, Councilmember Young, and even Councilmember Morrell have sponsored lots of new innovative programs. Some have worked great. Some have, had a little bit mixed results, but we didn't just sit back and say, gee, we hope this get better. Or we didn't just go to our biggest employer and said, here, we'll give you bucket loads of money. We really tried to get out across, and through public health, I think some of the serological testing is being supported through some of this CARES Act. And so it is a broad spectrum of where we're applying it. And what we need to do is keep doing that. But right now, that CARES Act money expires December 31st. And this sounds hard, but it's hard to spend $168 million. And it shouldn't be, because there's so much need, but to be able to track it to meet a government need, we need to find ways to make sure we're getting that money out there effectively to those who need it most. And most of all, give us the opportunity to go into next year with it. Bring us the HEROES Act funding. Bring us another level of this, because it's not over until, as the doctor said, next summer. We need to plan on that right now. And we really need that pipeline of funding coming down in, as we see here, hundreds of different ways. There's no one program to invest in. So sorry to kind of throw a bunch out there, but that's just the reality of where a lot of it is landing. And so I'm hopeful, though, because we are doing it in a lot of different areas. And if people see little pockets that we're missing, give us a call. Let us know. We'll do our best.
Pam, I have a sense that you have something to say, because I'm always connected to that with you.
Well, Councilmember Campbell, you were just blowing our mind as you were just, essentially, you were just rattling off every aspect of our daily lives and how things have been impacted. And if people didn't know it before this conversation, they should certainly be able to walk away understanding there. I mean, every single thing. This was not something that we could have foreseen. And even as it was evolving, we just had no idea. It's like a tsunami, and just it came in and it impacted everything. I think one thing that occurs to me as you were speaking that we really need to be mindful of is that I think we have this artificial timeline in our head about December 30th or December 31st, but the virus doesn't. And so we really need to be intentional. We need to be alert about what we are doing, because I really don't think there's much that's going to change between December 31st and the clock rolling over into January 1st. We will still be in this space and dealing with these challenges.
Yeah, I agree with that, and especially given what Dr. Hirschberg said about vaccines and next spring and maybe even beyond. So one of my questions.
And Amanda, if I may add one more thing, one of the things that we're funding right now is the purchase is almost $1 million for vaccine preparation. My understanding is that many of these vaccines will need to be like stored at like several degrees below zero. So we've got to build. So we're buying all new refrigeration, and we're getting ready so that when it does come, Pierce County's ready, and we're buying them now, because when the vaccine's announced, everyone's going to go out and say, okay, we need to buy a freezer. Yeah. And then they're not going to be there. And that's going to slow up the distribution much as anything, is that we're going to have a shortage of freezer installations across the nation, these sub-zero freezer installations. So
that freezers go down to minus 80. So you need to store minus 80 Celsius. So that's why they're a special type of freezer.
Yeah, and I think it's been a lot of work from people like you and the health department that's guided us to making sure that we're truly prepared, because some people think prepared means, oh, I got someone who can give the shot out. No, it's a lot more than that. Yep. Sorry.
Very good point. I want to close because I think we have answered the question about if we're confident that this will be the last holiday season, that we will be drastically impacted by COVID. So I want to ask the question in terms of ending this conversation on a hopeful note. And can each of you share where you are finding hope right now? And again, I'll let you jump in as you feel the need.
Well, I'll go because I gave so much bad news tonight, and I am a humanist, and I believe that we have a lot of resilience in our community. I've seen a lot. I have been working amongst people and seeing a lot of the goodwill and energy. I know there's a lot of bad news. But from the science standpoint, many people are first responders, I have, we have a community kitchen at Rain, and the food, people who run their businesses are feeding people every day and going out. And I've just seen so many amazing acts of just grace and kindness in the last few months. And, in spite of just such pessimism and negativity and people just not respecting each other on the political level, there's been amazing work done on the ground level. And that's, I feel, is where it matters. And so I am very optimistic. A lot of smart people are working on solutions, both from an economic standpoint and also from a science standpoint. And I do feel one of the reasons I push as hard as I do is we are going to get through this. And I'm hoping we're going to learn from it and we're going to do better the next time one of these pandemics comes around.
Thank you for that. Beautifully said.
And Dr. Hirschberg, thank you for using the word grace. I think that is something that is giving me hope. If folks weren't gracious in the way that they treated others before, it definitely is becoming a necessary characteristic and behavior now. I think when I think about students and teachers, or college students and professors, or employees and employers, or even just systems, that folks who are just figuring out so many new things, doing things for the first time, having high demands on needed resources. And I just have noticed a lot of grace and patience as systems transition, as businesses pivot and try new models. And I think folks maybe never really had to tap into that are learning how important it is right now, because so much of this is new to us. You just have to be patient and gracious. And those of us who've been in ALS or know how important gracious spaces are. So knowing that there is grace, knowing that I will start by giving myself grace, but that I can extend that to others, gives me a lot of hope.
Thank you, Senator Wagner.
I'll add on to that. I mean, of course, it's grace. It's people literally putting up tables in their front yards to give their neighbors food. It's the 1,000 little kind acts that I see everywhere. But it's also, sometimes you need this knock upside the head to do things that you could have been doing all along. You just never found the courage. Let's turn parking spaces into places for restaurants to serve food. Oh my God, how great that is. We're seeing innovation, not just in governmental sectors, but entrepreneurs are getting to stretch their legs and do things entrepreneurially that would have been too much of a risk before, but now they're trying it and they're having success. And so I think those are things that when we come out the back end, this has really shown some things that aren't that important in our lives, that we've clung to many times as, well, this is the way we've always done it. And if it isn't the way we've done it for the last 9 months or a year or however long we're shut down, then maybe it wasn't something we need to continue. And so some of that complete reworking of the way things work, the positives coming out and the negatives fading away on that, I think will be our best sets of positives. And when we do emerge and once we get things restabilized, I think we'll look back and see some really great innovative things. Even the doctor talking about this way of using RNA to address things, and I was over here nodding like I knew what he was talking about, and realizing that just because I heard the phrase doesn't mean I understand. But that's just a bright light to me too, because we're able to do things in a way we never allowed ourselves to do it before. Mm-hmm. So I remain hopeful.
Thank you for that. Thank you so much. Well, it is time for me to say, Pamela Duncan, can you please drive us home and tuck us in for the evening?
Before I do, I just want to make note of an article that just hit my inbox, and it's a very long URL. I would have shortened it if I had known it was going to show up like that, but essentially it's experts predict what the COVID-19 pandemic will be like in 2021. I mean, how timely is that? We're having a conversation right now. So I just wanted to let you know that that's what that link is to. And then I appreciate that when we get together, we talk about how we can be better. I appreciate hearing conversations about how community comes together and about extending grace to one another. I know that we have still a really long, tough road ahead of us, and I am convinced that we will get through this. We're tough and we are resilient. We can be gracious and still be tough and resilient, and we will get through this. We do have to take care of ourselves. It's all about, just like in the airplane, when the flight attendant tells us, you got to mask up yourself first. Somebody needs to use that as the campaign, maybe. You got to mask up yourself first, and so that you can take care of others. So that's my drive us home, tuck us in, mask up yourself first. Okay. Thank you, everyone, for being on the call. Thank you, Dr. Hirschberg and Councilmember Campbell. It's so good to see you. I sent you a little note in the chat, too. Please pay attention to that, sir.
I shall.
And, of course, Senator-elect Nobles. Again, I just delight in saying that. Yeah. Thank you all. Thank you to our wonderful moderator, Amanda. You did a delightful job as usual. And to everyone, good night.
Good night. Be safe.
Bye-bye. Thank you.